Okay. All right. So, Digby, what I'd like to know is, I know you've got a pretty broad spectrum of services you offer, and you have a pretty all-encompassing role here at Oasis Recovery. So, what would be, when you're meeting with somebody, do you give them the steps 1 through 6 with all your services, or what do you do? What's your approach with a client? Tell me about that.
It's the approach of the client is individual, person to person. It's not yet. We have a wide range, a broad range of services and activities and treatments that we can provide within the context of complementary alternative medicine, naturopathy, and natural health care. However, it's not like a program that we just lay out and you jump into it. It's individualized because from person to person to person, with plant medicines, for example, one person might really enjoy using tea, and tea fits in their lifestyle, fits with them, and they can use that very well. Another person might not be that's not their thing, so maybe essential oils would be a better avenue. And then within the plants, there are very different kinds of plants that have different kinds of effects. So it's individualized to the person. It's not a cookie cutter kind of plan where everybody goes through the same kind of thing. And also within that, then the person becomes in charge to a great extent of their health and wellness and their plan. The task is to help them develop something that they can implement, use here, and then take with them. So it's individualized in that way.
Sure.
With the needles, with the AccuDetox part of it, it's done in group. When we sit down in group, everybody comes in, and each time they come in, they're asked, do you want to do the needles today? More often than not, people get very attached to the needles. They're a very positive experience. And so they look forward to that because it really is a quieting time, a relaxing time, focusing, a very nurturing time for them to do that.
Sure, makes them feel better.
Yeah, and occasionally they'll get people, I don't like needles, I don't want to do needles. If they're not wanting to do the needle, which is okay, we can do something called seeds. They're little tiny seeds that we can tape onto those points. The effect is not quite as immediate, if you will, but it's a little more long-lasting because then we'll teach them, we'll put the seeds, take the little seeds onto the points, and then they can have them, and as they go through the week, if they get to a time where they're feeling a little craving or squirrely or uncomfortable, then they can just hold the ear and just jiggle a little seed or do something like this, so like a little ear massage on the seed, and it'll do the same thing.
Have that same calming effect.
So there are there are different options within it, but the overall idea, the overall understanding is really to create a unique and individual program for each person.
Right, and that way when they leave here, number one, that's tailored to what they're comfortable with, and that helps them the most. And then of course, if they're here and you're starting one thing and they said, this isn't working, then say, you know what, let's try this. So you'll adjust. So that's good.
And then we can teach. The idea is to teach and how people have skills they can take with them.
Right.
So with Chinese medicine, we're dealing with all the different acupuncture points. We can teach a thing called emotional freedom technique, EFT, where they learn to tap on different points as a help of dealing with trauma and disquiet. We can help them learn how to use acupressure, holding a point here, sort of the sea of tranquility point in the center, and then the third eye, or just becoming in a meditative position and just hold on those points and focus on breathing and quieting.
So when they come here, they haven't ever heard of any of these things. One thing they get to learn about some really new, terrific ways to help them lead a better life, and then learning's one thing about something new, but then developing skill sets and taking it with you out there in the real world is the most important part, I would imagine.
And then the last part about these is doing all of that, but also then integrating one. It's not an either or. It's not either you do the wellness or the disease model. It's both and. So we work to integrate. So we collaborate with the other therapists, with the other aspects of program here. So it's an integrated program. And then as the person leaves, we give them tools and skills, other resources in the community they can use. We encourage them always to be talking with their physicians and doctors, particularly if they're going to make a change in anything. We ask them to please talk to their primary care doctor or their psychiatrist or therapist about what they're doing and the changes they're making, so that we integrate with other providers, beyond the boundaries of Desert Oasis.
Right. So everybody, and especially particularly the person, the client, and everybody that's part of their support group knows what they're doing to try
Yes.
to improve their life and get it on the right track versus what they were doing before.
And
Well,
that they're telling that information, they're in charge of it, so that they have some command in their life versus what often happens in the world of treatment is the therapists are all talking, but they don't include the client in the plan.
yeah, they're well, so they're talking. So everybody, there's a two-way communication. That's
So here it's integrated as a full communication and encouraging the client to talk outside too.
well, that's a very very powerful treatment. Well, thanks for speaking with us today, Digby. I appreciate your time, and it's very enlightening. Thank you.
Thank you, sir.